Now, you had the radiotherapy and it wasn't necessarily straightforward, it wasn't necessarily easy.
No.
What were the main side effects you had?
Well, it's probably due to where the tumour was as well. I had
You want to tell people about that?
Very tired. My tumour,
Where was it?
Is. My tumour is at the top of the right-hand side of the lung, where I did develop blood clots, and I had to have injections to get rid of the blood clots and, well, give me some more time, if you like. But the radiotherapy apparently has shrunk it a bit. Having radiotherapy was a bit traumatic, but deep down you think, well, you've got to have pain to cure pain. I used to get very, very tired, and I couldn't eat properly. I used to have to go on special drinks so that I could get the nutrition, and finally I started to eat more solids, and they said I did cope with the radiotherapy very well.
What was it that was impacting upon your eating?
It was just I couldn't swallow.
It was inflamed in that area?
It was very inflamed, yeah, and my throat, that was sort of closing, but you just learn to sort of get on with it, you know.
So initially you had to adapt your diet?
That's right.
To more liquids and semi-solids, I think?
That's right, like custard or rice pudding, you know. But eventually you start to pick up and eat more solid food.
After how long would you say? Because some people will be in that situation and they want to know.
I'd say it took me about a good month. Yeah, a good month.
Now you had to rescan, I think, and then it was shown that you had improved in some ways. Yes,
it did. Although I was frightened going for the results of another scan, I sort of, they put the picture up on the screen and I'm closing my eyes and saying, turn it off, I don't want to see it, you know. And they just explained that they were very pleased that the tumour had shrunk and also that my blood clots had gone. And it was a big relief. Although they did explain that I can't have any more treatment, the cancer won't go, but they've tried to give me extra life, which they have.
And how do you feel about how it's been left for you with that level of information?
Well now, funnily enough, the last appointment I had with the oncology doctor, I was brave enough to look at the screen. Not showing everything, but where he explained about the cells and that, I was okay.
Were you able to see the area that was affected on the scan?
Not fully. It wasn't as clear as it was when I first seen the tumour.
Maybe that's a good sign that it wasn't as manifest on the scan, meaning that it was shrunk to some extent.
Yeah, that's right. But I'm glad I eventually did go to my GP, and I do get my moments where I am a bit frightened, but I wake up every morning and thinking, another day.